Hi everyone. Now we are discussing about hemodialysis. First, introduction of hemodialysis. Hemodialysis is a life-saving medical procedure that filters waste, toxins and excess water from the blood, acting as an artificial kidney for those with severe chronic kidney failure. It means ESRD. ESRD means end-stage renal disease or advanced CKD. CKD means chronic kidney disease. It involves pumping blood through a dialyzer machine which cleans the blood and returns it to the body, typically 3 times a week. Then, definition of hemodialysis. Hemodialysis is a renal replacement therapy used to remove waste products, excess fluid, and toxins from the blood when the kidney are unable to perform their normal function. Next, indications of hemodialysis. First one, acute kidney injury. It is known as AKI. Then, chronic kidney disease, CKD, especially stage 5 end stage renal disease. Severe indication of hemodialysis like uremia, hyperkalemia, then metabolic acidosis, fluid overload, drug toxicity, certain poisons. Next, principles of hemodialysis. There are 3 main principles are like first one, diffusion, then osmosis and ultrafiltration. Now discuss about what is diffusion. Diffusion is the movement of solutes, waste products like urea, creatine from an area of higher concentration to lower concentration across a semi-permeable membrane. This helps remove toxins from the blood into the dialysate. Then osmosis. Osmosis means the movement of water across a semi-permeable membrane from an area of lower solute concentration to high solute concentration. It helps in balancing fluid level between blood and dialysate. Then the important factors, principles of hemodialysis are ultrafiltration. Ultrafiltration means removal of excess fluid from the blood using pressure gradient. It's a hydrostatic pressure. This is especially important in patients with fluid overload. Next, vascular access of hemodialysis. There are 3 main access sites. First one, arteriovenous fistula, then arteriovenous graft, and third one is central venous catheter. Arteriovenous fistula, it's a gold standard and surgical connection between artery and vein. It's like long lasting and low infection risk. AV graft, it's a synthetic tube connection. Central venous catheter, it's a temporary access and higher infection risk. Now, what is AV fistula? AV fistula is an abnormal connection between an artery and a vein, causing blood to bypass capillaries and flow directly from an artery into a vein. Often is a surgical created to provide long-term access for hemodialysis. It can also occur through the injury or congenital issues. While essential for kidney failure, unmanaged fistula can cause swelling, reduce the blood flow and heart complications. Then we'll discuss about arteriovenous graft. Arteriovenous graft is a surgical created synthetic U-shaped tube. It is usually made up of polytetrafluoroethylene that connect an artery and directly to a vein, typically in the arm or leg. Grafts are typically be used within 2 to 3 weeks of insertion, sooner than fistula as they do not require maturation time. Next, central venous catheter. Central venous catheter is also known as CVC. CVC for dialysis is a flexible tube placed into large vein. typically the right internal jugular for temporary or urgent hemodialysis access. It allows immediate blood flow for patient with acute failure or while awaiting long-term access. Through it carry high risk of infection and thrombosis. Next, primary type of hemodialysis. Types mainly in center hemodialysis, then home hemodialysis, conventional home dialysis, and short daily home hemodialysis, and nocturnal home dialysis. First, what is center hemodialysis? It's a most common form where patient visit a clinic for treatment, usually 3 times a week for 3 to 5 hours. Home hemodialysis means performed at home, offering more flexibility. Conventional hemodialysis usually 3 times a week for 3 to 4 hours per section. Then short daily hemodialysis, it's a conducted 5 to 7 days a week and with the section lasting about 2 hours. Nocturnal hemodialysis, like it's a while done in sleeping and 4 to 6 nights a week for 6 to 8 hours, allowing for more through waste removal. Then specialized modalities of hemodialysis. First one, hemodiafiltration, HDF, or sustained low efficiency dialysis. It is also known as SLED. It's a hybrid method that combines conventional hemodialysis with a high volume filtration for better toxins removals. Mainly, there are used main types of special modalities like CRRT. It's a continuous renal replacement therapy. A continuous 24-hour slow dialysis method often used in intensive care unit for unstable or critical ill patients. Then during dialysis responsibilities. First one, monitoring, then complication management and technical assistance. Monitoring means monitor the blood pressure, heart rate and machine safety alarm every 50 to 30 minutes. Then complication management, like identify and manage the adverse reaction such as muscle cramps, nausea and dizziness or hypotension. Technical assistants work with the technicians to ensure machine functions and proper fluid removal. Then pre-dialysis responsibilities. First one, pre-dialysis responsibilities are mainly assessment site, then preparation and medication management. Assessment means wait patient to determine the fluid removal goals and check vitals and assess for edema. Assessment, it's a evaluate vascular assess for thrill or root and infections or infiltrations. Preparations, review lab results. Example, BUN. BUN means blood urea nitrogen, creatine and electrolytes. Medication management, it's a review and hold antihypertensive or medication that are dialyzed out. Next, discuss about post-dialysis responsibilities. First one, assess care. Then post-treatment assessment and documentation. Assess care means remove needle if applicable and apply the pressure to ensure the hemostatics and preventing bleeding or hematomas. Then post-treatment assess, reweight the patient and check vitals and assess for stability. Documentation, accurately record all the treatment data. First one, vascular access issues. Vascular access issues are the main issues are faced in hemodialysis patients. First one, infection. Infection means bacteria can enter the bloodstream through the access point, leading to redness, swelling, fever, or even like life-threatening sepsis. Clotting. Clotting means thrombosis. It's a scar tissue or blood clots can block the access and require surgery to repair. Next one, aneurysm. Aneurysm means repeated needle sticks can cause the vessels and wall to balloon. Long-term health risk. First one, heart disease. Then anemia and bone disease, sleep and mood disorder. These are the long-term health risk of hemodialysis. Next, let's talk about what is heart disease and anemia, bone disease and sleep mode disorder. First one, heart disease. It's a dialysis patient have 10 to 20 minutes higher risk of cardiovascular events like heart attack, stroke and irregular heart rhythm. Anemia, it's a low red blood cells counts are common because failing kidney produce less erythropoietin and iron is often lost during the dialysis process. Next one, bone disease. Bone disease, it's a long-term health risk of dialysis patients. It's an imbalance in calcium, phosphorus and vitamin D can weaken the bones leading to pain and increase the fracture risk. Next one, sleep and mood disorders. It's many patients experience insomnia and restless leg syndrome and depression due to the physical and emotional burden of the disease. Next one, complication of hemodialysis. There are many complications are included like hypertension, muscle cramps, itching, thrombosis. Let me discuss what is hypertension. Okay, hypertension means the most common side effects affecting 25% to 60% of a section. It happens when the fluid is removed too quickly and cause dizziness, nausea or fainting. Then muscle cramps. Muscle cramps is the most common complication faced by the dialysis patient. It's a frequently occur and especially in the leg due to the shifts in fluid and electrolytes like sodium. Next, itching. Itching means it's a very common complication, common both during and after treatment, often caused by the high phosphorus level or dry skin. And other complication like dialysis disequilibrium syndrome, arrhythmia and air embolism, hemolysis. Dialysis disequilibrium syndrome is cerebral edema from rapid urea removal, especially in patients, can cause confusion, seizures or coma. These are the syndromes and complications faced by the patients. First one, arrhythmia. Arrhythmia is triggered by the electrolyte shifts and or underlying the cardiac disease. Air embolism, it's a rare but life-threatening from the air entering the blood circuit. Next, hemolysis. Hemolysis is due to overheated and dialysate hypotonic solution or kinked the tubing. These are the main complications are faced the hemodialysis patient. Disequilibrium syndrome, it's a complications, cerebral edema and from rapid urea removal, It's like a confusion, seizures, or coma faced by the patients. Next, procedure of hemodialysis. First one, preparation. Then assess connection. Let's what is explain preparation, procedure of hemodialysis. Preparation means before starting, a nurse or technician check your vital signs including weight, blood pressure, pulse and temperature. This helps determine how much fluid needed to be removed during the section. Assess connections. Your lifeline to the machine is your vascular access site. It's a typically an AV fistula graft or catheter in your arm. If using a fistula or graft, two needles are inserted into the access. If using a catheter, the machine tubes are connected directly to it without the needle. Next procedure is filtration. Filtration means the main machine pumps your blood through the flexible plastic through tubes to the dialyzer. Then inside the dialyzer, your blood flow through the thousands of thin, hollow fibers while cleansing fluid called dialysate flow in the opposite direction on the outside of these fibers. The last one is exchange. Exchange is the important factors. It's the collecting waste and extra water move from your body into the dialysate, while essential elements like blood cells and proteins remains in your blood because they are too large to pass through the filter membrane. Next, monitoring and finishing. Monitoring it's throughout the section, which is typically lasts 3 to 5 hours. Staff regularly monitor your blood pressure and heart rate. You can usually read and watch TV or doing something rest during this time. Last, finishing. It's once the section is complete, the needles are removed if used and pressure is applied to the site and prevent bleeding. Your vitals are checked once more before. Last one, conclusion of hemodialysis. Hemodialysis is a life-saving medical procedure for patients with advanced kidney failure and functioning as an artificial kidney. Artificial kidney is also known as dialyzer. Dialyzer to filter the waste and excess fluid from the blood. While it is highly effective at managing the symptoms and stabilizing the health, it is a demanding typically lifelong treatment rather than cure. So I conclude. Thank you.